Today, we're going to talk about pantoprazole sodium, a medication used to treat certain stomach and esophagus problems, such as acid reflux. It works by reducing the amount of acid produced in the stomach, which can help relieve symptoms like heartburn, difficulty swallowing, and cough. In addition to providing relief, pantoprazole sodium also aids in healing acid damage to the stomach and esophagus, helps prevent ulcers, and may even lower the risk of esophageal cancer. It belongs to a class of drugs known as proton pump inhibitors, PPIs. As for the daily dosage, it's best to follow your doctor's instructions, but typically it's taken once a day before a meal. Remember, it's important to take pantoprazole sodium at the same time each day for the best results. If you have any concerns about when or how to take this medication, be sure to consult your healthcare provider for personalized advice. Before you start taking pantoprazole, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. The dosage and length of treatment are based on your medical condition and response to treatment. If you are taking the tablets, you may take them with or without food. Swallow the tablets whole. Do not split, crush, or chew the medication, as it may destroy the drug. If you are taking the granules, take your dose 30 minutes before a meal. To take it by mouth, open the packet and mix the granules in applesauce or apple juice. Do not mix with other foods or liquids. Do not crush or chew the granules. Sprinkle the granules on 1 teaspoon, 5 milliliters, of applesauce and swallow all of the mixture right away, within 10 minutes. Follow with sips of water. Or you can mix the granules with 1 teaspoon, 5 milliliters, of apple juice in a small cup, stir for 5 seconds, and swallow all of the mixture right away. If you are giving the granules through a tube into the stomach, ask your healthcare professional for detailed instructions on how to properly mix and give it. If needed, antacids may be taken along with this medication, and if you are also taking sucralfate, take pantoprazole at least 30 minutes before sucralfate. Use this medication regularly to get the most benefit from it. Take it at the same time each day, and continue to take it for the prescribed length of treatment even if you are feeling better. Lastly, tell your doctor if your condition lasts or gets worse, and ask your doctor how long you should take this medication. If you experience headache or diarrhea, it is important to inform your doctor or pharmacist. This medication has been prescribed to you because the benefits outweigh the risk of side effects. However, it is important to be aware of any serious side effects, such as symptoms of low magnesium blood level or signs of lupus. Additionally, this medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you experience symptoms such as persistent diarrhea, abdominal pain, or blood/mucus in your stool, it is important to seek medical attention. It is also important to note that proton pump inhibitors, like pantoprazole, may rarely cause vitamin B12 deficiency if taken for a long time. If you develop symptoms of vitamin B12 deficiency, such as weakness or numbness/tingling of the hands/feet, it is important to inform your doctor. Lastly, while a serious allergic reaction to this drug is rare, it is important to seek medical help if you notice any symptoms of a serious allergic reaction. If you notice any other effects not listed above, it is important to contact your doctor or pharmacist for advice. Before taking pantoprazole, make sure to let your doctor or pharmacist know if you are allergic to it or similar drugs, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss this with your pharmacist for more details. Before using pantoprazole, it's important to share your medical history with your doctor or pharmacist, especially if you have liver disease or lupus. Some symptoms may be signs of a more serious condition. Seek medical help right away if you experience heartburn with lightheadedness, sweating, or dizziness, or if you have chest, jaw, arm, or shoulder pain, especially if it's accompanied by shortness of breath, unusual sweating, or unexplained weight loss. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Proton pump inhibitors like pantoprazole may increase the risk of bone fractures, especially with longer use, higher doses, and in older adults. It's important to talk to your doctor or pharmacist about ways to prevent bone loss and fractures, such as by taking calcium and vitamin D supplements. Older adults may be more sensitive to the side effects of this drug, including bone loss and fractures, as well as C. difficile infection. It's important to be aware of these potential risks. During pregnancy, pantoprazole should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using pantoprazole, as this medication can pass into breast milk. It's important to be aware of how pantoprazole sodium may interact with other medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products need stomach acid to be properly absorbed by the body, and since pantoprazole sodium decreases stomach acid, it may change how well these products work. This includes medications such as ampicillin, atazanavir, erlotinib, and others. It's also important to note that pantoprazole sodium may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and your doctors that you are using this medication. If someone has taken too much pantoprazole sodium and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. If your doctor tells you to use this medication regularly for a long period, you may need to have lab or medical tests, such as a magnesium blood test or checking your vitamin B12 levels. It's important to keep all your medical and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose of pantoprazole sodium, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. Make sure to store pantoprazole sodium at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard it. If you have any questions about how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.